Have you been recommended any of the following stretches to relieve your sciatica pain? Sciatic nerve glides or nerve flossing, hamstring stretches, pigeon pose, piriformis, or figure four stretches? If so, then stop. Chances are these stretches are keeping you from healing and making you worse. Hey everyone, this is Dr. Charlie Johnson, a physical therapist, and in this video I'm going to share with you the top 2 most dangerous stretches for sciatica and why they literally cut off your body's ability to heal. Then I'm going to show you exactly how these stretches are showing up in your life so you can identify the habits and routines that are keeping you from getting better. And finally, because every sciatica case is different, I'm going to show you how you can test for yourself and know immediately whether or not these stretches are something that will make you better, something you should do, something that's a waste of time, or if they are in fact killing your chances of relief. The first most dangerous stretch is what most people call a sciatic nerve floss or nerve glide. And if you search online or you see a physical therapist, you'll almost always be recommended this stretch to reduce your nerve pain and improve your nerve mobility. But I've actually found that it makes most people worse. And one of the most common ways you're told to do this stretch is to take your painful leg and extend your knee until you feel the start of your sciatica symptoms and then let it down. And if that's not enough, you're told to pump your ankle to make it more intense, and you're instructed to do this over and over again. The second most dangerous stretch is a figure four stretch, also known as a piriformis or glute stretch, where you take your painful leg, you pull that knee towards your opposite shoulder until you feel stretched deep in your buttock, or you take the other leg and you pull it up towards your chest. Now you're probably wondering, why are these stretches so dangerous? Here are 3 reasons why. Reason number 1, the nerve glide stretch I showed you mimics the exact test that's used by doctors to make your sciatica symptoms worse and diagnose it. We call it a straight leg raise test, and it looks like this. So we take your painful leg, we raise it up, and somewhere between 30 and 70 degrees of that leg raise will reproduce your pain, numbness, or tingling if you have sciatica. Now, this test is so good, such that you can be 90% or more confident that you do not have sciatica if this leg raise test is pain-free or normal. In other words, whoever told you to do this as an exercise to relieve your sciatica pain is basically telling you to take the thing which is known to make you worse and do it over and over again so that eventually you'll feel better. This is opposite of the old saying where you tell your doctor that something makes you worse, and instead of telling you not to do it, they're telling you to do it repeatedly and you're listening. Reason number 2, research shows that stretching your sciatic nerve to the point of it reproducing your symptoms actually cuts off blood supply to the nerve and chokes off the ability for it to receive the oxygen and nutrients that it needs to heal and function properly. You can see here that if a peripheral nerve, the sciatic nerve, is to function properly, it must receive a continuous and adequate supply of oxygen and other nutrients through the intraneural vascular system or through its blood supply. It has been demonstrated that complete ischemia, or cutting off of the blood supply, is followed by a deterioration of nerve function. And what researchers found is that as little as 15.7% stretch to a sensitive sciatic nerve can completely cut off its blood supply. So if this is the sciatic nerve and this is 100% stretch, then maybe this is 15.7. You can see that it doesn't take much. No good. And this research article shows that irritated nerves that are stretched to the point of you feeling symptoms lose function. It goes on to state that temporary ischemic or blood supply changes in the nerve root induced by the root stretching cause transient conduction disturbances or temporary slowing of nerve function. The results show that during the SLR test, the straight leg raise test, intravesicular blood flow or blood flow to the nerve showed a sharp decrease at the angle that produced sciatica symptoms, which lasted for 1 minute beyond the end of the straight leg raise test. It then goes on to discuss how stretching of nerve roots can result in nerve damage. Simply put, if you're trying the exercises we talked about earlier and you're reproducing your sciatica symptoms, then know that you're cutting off the blood supply to the nerve and you're choking off the oxygen and nutrients that it needs to heal, basically causing it not to work as well. And reason number 3, recent research shows no additional benefit of a sciatic nerve stretch or nerve glide when compared to another common sciatica exercise alone. So if they're potentially dangerous and not clearly effective, then why do so many doctors recommend them? And well, I don't know. But hopefully you can see by now that the risk of doing these stretches is not worth the reward. And you couple this with the fact that pain makes most of us go insane. We adopt a more is better, no pain, no gain mentality. It can be easy to overdo these stretches and cause further inflammation to the sciatic nerve. And it's because of this that I almost never recommend these exercises to people with sciatica. Instead, I opt for safer, less risky, totally pain-free exercises. In fact, most of my patients improve dramatically when they stop doing these stretches. By maximizing blood supply to the injured nerve, we can give it the best chance of healing as quickly as possible. Now, simply stopping these exercises alone isn't enough. It's important to note that these painful motions, the straight leg raise and the figure 4 stretch, are showing up in your life in ways you don't know yet that are keeping you from healing. Here's exactly what I mean. So if you're here right now, chances are you have a yucky leg raise. You probably also have a yucky figure 4. But again, these are the exact stretches that you've been told to do to bring about relief. What happens though if that motion, which you're repeating over and over again, is not only showing up in your exercise routine, but what if it's showing up in the way that you live your life, the habits, routines, activities, things like that? And well, it sure does. Let's talk first about the leg raise. So these are all the ways that the leg raise can show up in your life, just some of them, in ways that continue to pick the scab. So it's possible that the leg raise is showing up in your current exercise routine or your physical therapy sheet of exercises that you're doing to feel better. So maybe you're a golfer and you perform a golfer's lift to pick things up. Maybe this is an exercise, a single leg deadlift that you perform at the gym. You can see the L shape, leg raise shape right there. You can see here that you could do a seated nerve glide. You could do a lying nerve glide, both of which are leg raises. Or maybe we want to call it something different. Let's call this one a hamstring stretch. So now you're doing multiple different exercises, right? Well, not really. They're all the same thing. Again, in disguise, called different things. A slump slider or a slump stretch. A leg raise. You can do another exercise. I don't know what the name of this would be, but this is a standing nerve glide. You're doing all these different leg raises or nerve glides at home, but maybe someone else is doing it for you as well in the form of a specific stretch or something like that. Maybe you've been led to believe that yoga is the best thing to resolve your sciatica, so you're doing a leg raise in the form of a downward dog. It's just picking the scab constantly. Not only does it show up in your current routine and your workouts and whatnot, but it's probably showing up in the way you sit and drive as well. So a lot of people, when they're driving, obviously have an outstretched leg. That is a leg raise. And we can manipulate that by moving the seat closer, changing how we go about driving as far as the position, the surface, all that stuff. Maybe it's showing up in the way you're sitting, at night. Maybe you're kicking your legs up on a coffee table or on an ottoman or recliner or something like that, and this is a leg raise showing up again. Want to know why you can't run? Well, you can't run because running is a leg raise. Want to know why you can't pick something up? Picking up is a leg raise. And so again, we've got to tweak or modify the way we do these things, otherwise we'll constantly be picking the scab. Sleeping is also another way where sometimes people sling the leg over, and a leg raise could show up. So those are all the ways that a leg raise, which is yucky and painful, which we know it is because that's a test used to reproduce your sciatica symptoms, could show up for you in ways you weren't sure of. Now let's talk about the figure 4, because there's lots of sneaky ways this can show up as well. Again, in the current exercise routine, so possible you're doing a figure 4 stretch like this, but maybe you're also doing a pigeon pose. But aren't they different, Charlie? Well, not really. Slightly different position, but again, it's a figure 4 motion of the leg, the same painful position. How about child's pose? A little sneaky. Bet you didn't think about that. You know, most of us don't go back into child's pose with our knees together. We kind of splay them out. Puts us in this frog-like position, which is basically a figure 4, a deep glute stretch on both sides. Maybe you're doing it in seated. Maybe the person you're working with is doing hands-on treatment and moving you into that rotated figure 4 position, and you wonder why you're not getting better. It's possible you also have some habits and routines as it relates to sitting. If you were sitting crisscross applesauce, that's a figure 4. Maybe you kind of sit in this side swept position. Maybe you have a habit of crossing your legs, where you put your ankle over your knee. Again, a pretty clear figure 4. Or maybe it's a little bit more subtle, where you put your knee over top of your other knee. Maybe you're excited about what you do at work and or just lean in as you do different things, and you reduce what we call that hip trunk angle. Again, the legs are slightly widened there, and you move yourself into that kind of deep glute child's pose stretch, if you can see the similarities there. Right? So it's also going to show up in the way that you stand. So if you stand and you weight bear mostly through one leg, then realize that this is sort of creating that crossover or cross-legged type of appearance where your leg is diving in, moves you closer to a figure 4. Maybe you stand like this. This is my wife. She stands in kind of this tree pose, and she could be working like this for quite some time and wouldn't even know it. Again, it's a habit for her. But again, figure 4. And many times it shows up in the way that you're sleeping. So if you cross your legs at the ankle, if you sleep in funky positions like this, on your side with your leg falling over, in a trunk rotated position like this is how I sleep a lot of times, at figure 4. On your side, frog leg position, all figure 4s. And so, you know, a lot of times the thing which is said to help us may actually keep us from getting better. So if figure 4 is a yucky motion, well, look what happens when you put a pillow just between your knees. Well, you still have your legs crossed, moves you closer to that figure 4 motion. Is that really what we want? Well, what if we put a pillow between the knees and between the ankles? That would prevent the figure 4 altogether. So again, there's more where this comes from, just some basic suggestions, but I think you get the idea of how these things are showing up in your life. And now that you know why these stretches can be so dangerous and the way that they show up in your exercise routines in day-to-day life that might be keeping you from getting better, I want to show you one final thing. Did you notice earlier how I mentioned that I almost never prescribe these specific stretches? Well, despite the fact that I generally don't recommend them for most people, it's possible, depending upon where you're at on your healing journey, you might actually find them helpful. And so rather than making your decision based off of what you or I or your doctor thinks or feels about these specific stretches, I found it best to just test and let the data and the results speak for themselves. And so now I want to show you exactly how you can prove for yourself whether or not these stretches are something that's going to be helpful, something that's going to be a waste of time, or something that is, in fact, going to kill your chances of recovery. So we're going to follow a test, treat, retest process. And step one is to test. So we're going to do a yucky motion, do your yucky leg raise just one time, and you're going to note how high you can lift your leg and what it feels like. You can follow along with me if you'd like. Step two is to treat. You're going to do the nerve glide, or the thing that you've been recommended to do for treatment, which is said to relieve your symptoms. In this case, I'm going to say do it like this, lying on your back, 3 sets of 10 reps. Then step three is you're going to retest, which means do the leg raise again, just one time. Note how far now you can raise your leg and what it feels like. And the final step, step four, is see what happens. Is your leg raise worse? Is it more tight? Is it more painful? Is it the same? No change? Or is it better? If worse, the sciatic nerve glide stretch makes you worse, and doing it over and over again will make you worse. If same, then it doesn't make a change, and it's probably a waste of time. And if better, the nerve glide stretch seems to be helpful, at least in the moment. And now we can go ahead and repeat the same exact process to see if the figure 4 stretch is right for you. Step one, you're going to test or do your yucky leg raise just one time, see how high or how far it goes and what it feels like. Step two, same exact process. You're going to do the treatment you've been recommended. In this case, the figure 4 piriformis or glute stretch. And for the sake of this video, let's just say you're going to do 3 30-second holds. And now you're going to retest. Do the leg raise just one time again to see how far you can go now and to see what it feels like. And the fourth final step is to see what happens. Does doing your figure 4 stretch immediately make your leg raise worse, more tight, more painful? Does it make it the same, no difference? Or does it make your leg raise and your sciatica symptoms better? If your leg raise is now worse, then the figure 4 stretch makes you worse, and doing it over and over again is likely to make you worse. If you feel the same, it's probably a waste of time. And if your leg raise is better, then the figure 4 stretch appears to be helpful, again, at least in the moment. Now, just to clear something up, you might be wondering, well, who cares, Charlie, about the leg raise? I just want my sciatica symptoms to go away. But the cool thing is that that's how your sciatica symptoms are showing up, in the form of a leg raise, which is painful or limited. So rather than being focused on fixing a herniated disc or spinal stenosis, you're actually just focused now on fixing a painful leg raise. And so we can actually go through this test, treat, retest process to determine if these stretches are something that's going to be valuable for you or not. So there you have it, the 2 most dangerous sciatica stretches that doctors everywhere are blindly recommending for sciatica relief, despite it being the motion that they use to make your sciatica symptoms worse. Also, the fact that research shows that it actually cuts off blood supply, oxygen, and nutrients to an already angry nerve, without testing it to prove, number 1, it's safe for you, and 2, immediately effective for your specific case. And as a cherry on top, they dress it up, disguise it, prescribe it to you, mixed in with a sheet of other exercises, and call it different things. And of course, if you did find one or both of these stretches helpful, and they did in fact make your leg raise immediately better, then great. Just be gentle and cautious moving forward. If you're like many of my patients who have tried these stretches and it hasn't worked, or they make you worse, then you're probably wondering what you can do instead. So if you'd like to learn some safe, totally pain-free exercises, tips, and strategies to resolve your sciatica pain naturally, just click the links to the videos above. Thanks so much for watching, and be sure to subscribe for other videos just like this.